All right, next, some of the ones that we use in the neuro area quite a bit more than others, the NeuroFlam. These are going to be curcumin, turmeric, some different anti-inflammatory properties to it. The NeuroFlam is going to be nice 2-3 times a day, really calm down any inflammation, could be post-concussion, things like that. Neuro 2 is going to be for oxygenation to the brain, so it's the fever-free, magnesium, cayenne pepper, some of those things that are going to really get blood flow going to the brain. So if somebody has a cold brain, that's a nice one to get started on. Oxycell is going to be another cream, and that's going to be glutathione and SOD, superoxide dismutase, and that's going to be a very good source of glutathione. So we need to be able to put that on multiple times a day, and you can apply that to any soft area in there. So it could be inside of the arm, inside of the groin, some of those different places. Proglyco SP is going to be the other blood sugar support. So this one is going to be for low blood sugar symptoms as opposed to high blood sugar symptoms. And some people, you can even take that in between the meals so that they don't crash. So this would be after using the blood sugar monitor. If we can't figure out why it's going up, why it's going down, why it's crashing, this would be a nice one to do some support there as well. RepairVite is going to be the very common one that we use for leaky gut support. This is a 2-week program. You basically go on an autoimmune paleo diet, use the powder, glutamine, marshmallow root, aloe vera, a bunch of different nutrients in there to help heal up that small intestine lining. We use this with a lot of patients. If somebody has autoimmune, inflammatory processes, anything like that, we've got to go through and do this healing. I always ask people at the end of the 2 weeks, are you 90% better? Are you feeling great? Are you losing weight? Is energy back? If it is, good, we'll move on to the next step. If they're like 50% better, things are finally starting to progress a little bit, things are starting to change, then we'll probably want to do another two-week round of that. So occasionally we will do 4 weeks on that one, but a lot of times just 2 weeks. The Testanex is going to be a great one for any male that is spilling testosterone over to estrogen, usually a blood sugar issue, so we've got to calm that down first. But for a lot of people that are spilling testosterone to estrogen, this is going to be a great way to block that. Not going to fix it long term, but at least short term block it. So worrying about prostate, hair falling out, all those types of things. Thyrosin B, this is as in thyroid conversion. So a lot of patients, if they have high T4 or T4 at the upper end, but low T3, they're not converting like they need to. So this can be a big part of the issue there, is that we need to convert that thyroid T4 to T3 better. That's done in the liver, done in the gut, so we've got to work through the liver, we've got to work through the gut, but supplementation can be helpful in there as well. Turmeric, one of the better turmeric products out there is Apex. It's a liquid form. It's going to be either in a little plunger that we'll put into the mouth. 10 milliliters is a whole tube full, and if somebody really needs therapeutic dose, that's what it's going to take. It's equal to about a 1/4 cup of powder turmeric in that 5 milliliters. And we do have the soft gels for people that don't want to mess with it. They may get orange stain on their hands or things like that. Resveratrol, this is a great source of liquid resveratrol. Both the flavor of the resveratrol and the turmeric are really good. No issues there at all with flavor. A lot of people say the turmeric even tastes like an orange creamsicle. The X-Viramin, really good for antiviral. Yeastinol, obviously really good for an anti-yeast as well. Then the last one for Apex is going to be the Clearvite. Clearvite is our 3-week liver cleanse, and that one's going to be very self-explanatory in the binder, and we use that one quite a bit. A lot of patients will start there. After figuring out their blood sugar, we'll go first into that Clearvite, and then we'll go into the RepairVite after that one.